If you've ever been involved in getting a specialized medication approved, like Erivedge for basal cell carcinoma, you know just how much work goes into that prior authorization process, especially with insurers like Humana. Today we're breaking down why prior authorization for Erivedge is so essential, why Humana requires it, and how to navigate the process step by step to secure approval with minimal hassle. First, let's understand why prior authorization is necessary here. Erivedge is a specialized treatment designed for advanced cases of basal cell carcinoma, especially metastatic types. This medication is powerful and specifically formulated to prevent tumor recurrence for patients who have few alternatives. Given its targeted nature and high cost, Humana, like many insurers, has developed strict clinical guidelines to ensure Erivedge is essential for each patient before agreeing to cover it. This isn't just about cost control. It's about making sure the right patients have access to this potent drug without overuse. Let's go through the prior authorization process step by step, imagining you're filling it out for a real patient. First up, drug details. For Erivedge, it's essential to specify the standard 150 milligrams capsule dose, and note that only the brand version is required, as no generic alternative exists. Getting these details right is essential to avoid unnecessary back and forth with the insurer. Next, you'll enter the correct ICD-10 code. For basal cell carcinoma, C44.91 typically applies, linking the patient's diagnosis with the prescribed medication. Humana and other insurers rely on this code to verify that the treatment is clinically appropriate, so accuracy here is critical to avoid processing issues. You'll then need to include the prescriber's information. This section verifies the physician's license and contact details, ensuring that a qualified provider is behind the request. While it may seem basic, it's a crucial checkpoint for insurance verification. At this point, you'll determine the urgency level of the request. Most Erivedge prescriptions fall under standard non-urgent processing. While non-urgent requests take a few business days, processing time can vary depending on Humana's current workload and the specifics of the patient's insurance plan. Then comes the key part, medical justification. This is where you make the case for Erivedge, explaining how its tumor-reducing properties meet the patient's specific needs. Clearly connecting Erivedge's benefits with the patient's diagnosis strengthens the request, increasing the likelihood of a smooth approval. It's also essential to attach supporting documents. Medical notes, treatment history, and diagnostic results help clarify why this particular patient needs Erivedge. Thorough documentation reduces the chance of follow-up requests and delays, an area where Staffingly's dedicated team can make a big difference. Staffingly helps healthcare providers navigate the entire prior authorization process, ensuring every supporting document is accounted for, and that each form is filled out accurately the first time. This can be especially valuable when handling multiple PA requests, saving providers time and preventing unnecessary administrative hassle. Finally, once you've filled everything out, you can submit the completed form. From there, Humana's team assesses the request to ensure it aligns with their guidelines for Erivedge. If everything checks out, approval follows swiftly. If not, options to appeal are available, and Staffingly can also assist in preparing strong appeal cases, ensuring each request receives thorough consideration. Let's cover some common questions. Why does Erivedge require prior authorization? Simply put, it's due to Erivedge's specialized nature. It's intended for advanced basal cell carcinoma cases, and Humana wants to ensure that it's used correctly and cost-effectively. What if the authorization is denied? If you receive a denial, you're not out of options. Start by gathering more supporting documentation to strengthen the case, or consider using an appeal letter from the physician explaining why Erivedge is essential for this specific case. Staffingly's team is experienced in navigating appeals, helping providers gather additional evidence and structure effective appeals that meet insurer standards. How long does the prior authorization process take? Typically, non-urgent requests take several business days, but processing can vary with specific plan details and workload. Working with a service like Staffingly can expedite this, as they know the ins and outs of each insurer's unique guidelines. So what have we learned? Getting prior authorization for a medication like Erivedge doesn't have to be overwhelming if you focus on a few key points. Precision matters. Details like the ICD code and prescriber information are essential for approval. Documentation is key. Thoroughly backing up your request with medical evidence reduces delays and strengthens the case. Support can make a difference. By partnering with a dedicated team like Staffingly, you're ensuring that every piece of the PA process, from documentation to appeals, is handled with expertise and efficiency. Staffingly's experience can help prevent denials, shorten approval times, and ultimately make the entire process less time-consuming for you and your staff. Thanks for watching. We hope this breakdown makes the prior authorization process for Erivedge a little less daunting. With a service like Staffingly supporting your practice, you can navigate these processes more smoothly, letting you focus on what matters most, providing exceptional care to your patients.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.